Hi
Hi,
guys.
Dr. Ting.
Hi, I'm Dr. Jess Ting, and I'm here with Dr. Bella Avanessian, and we are two surgeons at the Center
Hi.
for Transgender Medicine and Surgery at Mount Sinai Hospital, and we're here today, um, basically to answer a bunch of questions that we've been getting from patients, and just to provide some reassurances and some information about what we're doing at Mount Sinai. So I'll tackle the first question, and I get this a lot. And the question is it safe to come to Mount Sinai for surgery right now? This is beginning of February 2021 in the midst of a second wave of COVID in New York. And the short answer to that is yes, it is very safe. We take maximal precautions at Mount Sinai to assure patient safety. Everyone who walks in the door is screened for a fever or COVID symptoms. 100% of our patients are tested for COVID within 72 hours of having surgery and must be negative. As far as hospital cleanliness, it has never been cleaner than it is now. The vast majority of our staff, all of our surgeons, and by the time you're seeing this message, probably all of our staff will have received at least one and most likely 2 doses of the vaccine. So the short answer is yes, it is absolutely safe. If you have been scheduled for surgery, you should not hesitate. You can come to Mount Sinai and have your surgery. We will take the best care of you that we know how to do. Bella, do you want to tackle the next question?
Sure. So I want to address what our current visitation policy is at the hospital where we operate in New York, Avanessian. And right now we're at the strictest that we've had. And the visiting hours are from 4 p.m. to 6 p.m., just a 2-hour window where each patient gets one visitor. And this can change as the situation with COVID is so fluid. Changes happen all the time. I don't expect it to go stricter than it is now, but hopefully our patients will get longer visitors.
Bella, do you want to answer the question of what happens if I screen positive for COVID and I'm scheduled to have surgery?
Sure. So if you screen positive right before your surgery, we have to postpone surgery for your safety. So the current policy is to wait 3 weeks. And then at the end of that time, as long as you haven't had symptoms within 72 hours, and ideally, if you have a negative test on repeat swab, we can proceed with scheduling your surgery again. And at that point, we would prioritize getting you back on the schedule within a matter of weeks.
Yeah, and I would add, this doesn't happen frequently, but in the handful of times that we have had a surgery that had to be canceled because of COVID, we have been able to get that patient back on the operating room schedule within a month. In the 1 or 2 times that happened with a patient of mine, the patient went ahead and completed their surgery safely and had no major problems after that. So even if you screen positive for COVID, don't let that dissuade you. We will still get your surgery done once you are recovered. Right, so I think we've covered the major questions, and in closing, I would just say we at Mount Sinai Center for Transgender Medicine and Surgery are here. We are operating full-time, we are fully operational, and we are not letting COVID stop us from providing the care that is really needed by our patients and by this community. So stay safe, stay healthy, and we will see you soon.